Hello, thank you for joining us for our Quality Assurance Trainings for 2024 for Liberty Resources Home Choices. My name is Pascal, and I'm going to be guiding you through our trainings. Now, we at Home Choices know how deeply you care about your work. We also know that you're terribly busy, and we do not ask for your time lightly. That's why we've chosen the most important quality assurance information to review so you can feel confident that we are delivering exactly what we promise. In this training, we're going to be reviewing some very important policies. Which policies? I'm so glad you asked. For the next couple slides, we're going to go over a few policies. We're going to go over our call-out policy, how to best use the EVV to make sure that you get paid everything you're deserved, our HIPAA compliance, and also how we resolve any complaints that are reported to LRHC. Now, we all know that sometimes things happen and you're going to have to call out. So what do? First thing, you want to call the 24/7 on-call scheduling phone number. The number is on the screen. It's 267-765-1550. You press 1 to call out. Again, this is 24/7 number. Now, direct care workers are mandated to give Home Choices at least 4 hours notice before you call out. Why do you think that is? It's to make sure that our consumers can get the best coverage possible. Any less than 4 hours notice, and it is very difficult to get adequate coverage. Now, the other side of the coin, if you give Home Choices at least 24 hours notice, you might be eligible to use your PTO for that shift, which means you will still get paid for that shift if you give us enough notice. Obviously, it's appreciated if DCWs help to cover that shift. And once you call out, Home Choices will notify the consumer immediately. If coverage for the consumer is unable to be found, Home Choices will document this in HHA as a missed visit. This is going to trigger a quality management follow-up. Scheduling leadership in HR will be notified, and if there are no informal supports or immediate coverage option, the supports coordinator will be contacted. Everyone should follow reportable incidents or COVID protocols if the reasons for the emergency removal falls into either of those categories. So we know that if a call out requires it, it's going to be recorded in HHA as a missed visit. But what exactly do you put into HHA? You want to make note if it's compliant or non-compliant call out, or if it's an emergency restaffing. You want to make note of the reason for the call out or coverage gap. This could be medical, transportation issues. You want to specify if it's possibly a public emergency situation that could impact travel or something like a scheduling conflict. Of course, if the reason is medical and it pertains to COVID-19, follow all the COVID-19 internal call out procedures. If you can put as much detail in HHA as possible, that is really what is best practice. You want to ensure to include factors that could complicate staffing for the missed visit issues. Note why the coverage was unavailable, including location issues, shift time, challenging matching situations, and also include any attempts to restaff, including the time period spent attempting to restaff and the number of direct care workers you contacted in an attempt to fill this coverage gap. In addition to the things that you did to attempt to fill this coverage gap, you also want to take note in HHA of the communication you've had with the consumer. Did the consumer assess their own risk and say, it's okay, I can forego to have coverage for these few hours, or did they say, I actually really need some help during these few hours? So including the consumer assessment of their own risk, as well as the availability or lack of availability for informal support, meaning family members, friends, neighbors, etc. Let's move on to our EVV policy. All direct care workers should be clocking in and clocking out using the HHA Exchange app, which is the preferred method, although the other method is to use the telephonic process with agency approval. If there's an unregistered clock in and out EVV, both a completed and signed coverage authorization form and consumer verbal verification is required for the payment of the shift. We're going to go into that in a little more detail. So we know that if there's an invalid EVV, clock in or clock out, we need to submit a fully executed CAF, and we need consumer verbal verification. So what is this CAF? Well, coverage authorization forms are used to verify coverage if EVV is not available or if a manual adjustment is needed to close that shift. Now, schedulers may request a CAF to resolve any discrepancies with EVV data, including GPS location, phone number, time clocked in and out, etc., things like that. If you fail to complete and submit the CAF, or if you submit the CAF and there is no verbal consumer verification, this may result in you getting a delayed payment. Now, while the CAF might seem like a really convenient alternative to the EVV, CAFs are not timesheets and you should not abuse them. They are not permitted to be utilized on a consistent basis. It is the direct care worker's responsibility to correctly complete the EVV or notify LHC immediately when issues occur. It is not the consumer's responsibility to complete the EVV or submit the CAF. In fact, if a consumer completes the EVV, it may be considered fraud. So we know that we can't abuse the CAF system. So when are we allowed to use the CAF system? Well, CAFs are required for a number of different reasons, including if you remember to clock in but forgot to clock out, or vice versa, if you completely forgot to both clock in and out, if you're out of range of the GPS, if you use an unauthorized phone number, if you had no resources to complete the EVV via telephonic or use the app, or at the scheduler's request per necessity. Now, the process for using CAF isn't that complicated. Once the scheduler realizes that the CAF will be necessary, the scheduler will reach out to the consumer and confirm that there have been no hospitalizations, rehab admissions, any outpatient procedures, or ER visits. Because remember, no billable services are allowed to be delivered to consumers during that time. We will also confirm with the consumer that services were delivered on a specific date, specific time, with this specific direct care worker, and include what tasks or services were performed. We will also document the consumer verbal verification in HHA and enter any manual adjustments into the task code in accordance with the consumer's verbal verification. Then the visit will be flagged as timesheet required for payment. Once all that information is confirmed with the consumer, then the direct care worker will send the CAF through your preferred method, which you will sign and submit. You can do that in a number of ways. You can do it electronically via Blue Ink software. You can fax it to us if you're old school via the phone number 215-701-8759 with the attention of your assigned scheduler, or you can email it to LRHCscheduler@libertyresources.org. Now, if your consumer is with Keystone, you will be required to send in physical forms to LHC reflecting a wet signature from the attendant as well as the consumer. So again, we're going to need that dual verification between the care worker and the consumer. Once that is done, we can verify the manual adjustments and enter the appropriate task codes. Now, it is true that properly clocking in and clocking out will make our lives at LHC easier, and it'll ensure adequate coverage for your consumers. But it is also the best way to make sure that you avoid any pay issues. We want to make sure that you get paid properly, on time, in the correct amount. So don't play with your pay. Clock in, clock out, and get your money, honey. Let's move on to our HIPAA policy. LHC provides all consumers with a copy of our Notice of Privacy Practices in their enrollment packet. This is going to outline our uses and disclosures of personal health information, individuals' rights, and our legal duties. Consumers will provide LHC a signed acknowledgement upon receipt of the LRHC handbook, and any documents that are given to the consumer upon enrollment, including our notice of privacy practices. Consumers can at any time request an additional copy from any LRHC staff member. Now, this content of the Notice of Private Practices are continually monitored by our quality assurance team, and we want to make sure that they are always up to date and in continued compliance with state and federal law. What if a consumer or a direct care worker has a complaint? Do we have a policy for that? Yes, I'm so glad you asked. Our policy is put in place to ensure that all complaints are handled uniformly and fairly, and that no disruption of service results from filing the complaint. Of course, whenever possible, all consumer concerns should be addressed immediately to avoid escalation to an official complaint. But whenever a concern is reported to any LHC staff member, the following info will be documented in HHA. When a complaint is communicated to LHC, we want to make sure we document that in HHA. We want to make sure that we take note of the consumer's name, the nature of the complaint, the date that the complaint was communicated to LHC staff. If that consumer's complaint has to do with a direct care worker, we want to make sure to link the care worker's profile in HHA. We also want to take note of the actions that LHC took to resolve the complaint, as well as note the consumer's satisfaction or lack thereof with the resolution. Now, any LHC staff member can receive and document a complaint, but it should always be forwarded to the Quality Management Manager for resolution. And that's me. That's me. I'm the manager for QM. My name is Pascal Valet. You can email any complaints at pascalvalet@libertyresources.org, or you can shoot me a call, leave me a voicemail at 215-634-2000, extension 498. Once I receive the complaint, we will conduct a thorough investigation, affording all parties an opportunity to submit evidence, tell their side of the story, and we'll get down to the root issue. Within 30 days of receiving the complaint, the Quality Management Department is required to inform the Executive Director of this grievance. The Executive Director will review the investigation and deliver a written decision on the grievance no later than 30 days after its filing. Now, is the decision final? Well, there is an appeals process. Anyone can submit an appeal up to 15 days after receiving the decision on this grievance. Now, of course, Liberty Home Choices will offer reasonable accommodations to anyone requiring them in order to submit or defend themselves from a grievance. Reasonable accommodations can include, but are not limited to, receiving ASL interpretation, getting recordings of the material, or us offering a barrier-free location for the proceedings. Thank you so much for hanging out with me over the last 15 minutes going over our policies and procedures. Again, my name is Pascal Valet. I'm the Manager of Quality Management over at Liberty Home Choices. On the screen, you see my email address and my phone number. Please don't hesitate to reach out with any questions.